Yeah. Wrong.
Okay. Morning. We'll start off with introducing ourselves. This is Dr. Gopi, an interventional cardiologist, and I am Dr. Rehan, a cardiovascular thoracic surgeon. Both of us got into the field of multiple sclerosis and thought that with our expertise in endovascular stenting and stenting of coronary arteries and other veins, that we would try to do the liberation therapy with the Dr. Zamboni protocols. Today we are here to discuss Valerie Lilley, a 52-year-old lady from Canada who decided to make the trip down to India to get the liberation therapy done. Val actually is in the progressive stage of multiple sclerosis, and she's tried all forms of and all modalities of therapy for multiple sclerosis and found no great benefit out of it. So decided that she wanted the CCSVI therapy to be done. She came down to Fortis Hospitals at Bangalore, where we both function out of, and we got a jugular venous Doppler done, and lo and behold, the jugular venous Doppler was normal. And so now we had a confused Val who was wondering, what are we going to find on the venogram? So we went ahead and did the venogram last evening, and we found that both her azygos and her left jugular vein were normal, but there was a very critical obstruction in the right jugular vein at the level of the C1 vertebra, actually between the jugular foramen and the C1 vertebra, which is as high as it can get. And that is usually the location wherein the cranial nerves come out along with the jugular vein. So stenting that area can be tricky because we could potentially leave the patient with persistent pain, or we could leave the patient with cranial nerve palsies. And this was a very difficult decision to make, both for the patient and for us.
Okay, it's on.
Yeah, so this is the venography of Valerie. If you notice that this is the first injection which we are doing in the azygos vein, and you would notice that there is a good lumen throughout without any specific narrowing. Following that, this is the left jugular vein. Again, you would find that it's a widely patent vein all throughout. If we compare this to what we see on the right side, here you find that there is a narrowing at this particular point, just between the first vertebrae and the skull. So this was of some concern to us to do a procedure, because it was very, very close to the jugular foramen and where the cranial nerves come in. So anyway, we went ahead and initially dilated it with a 6 mm balloon. Following that, we still had a significant amount of residual stenosis and thought that we should stent the same. But there was some worry about the stenting, because as I told you, we were worried about the pain that it would cause and also the problems to the cranial nerves. We cautiously put in a 7 mm stent into this, and we placed it a little bit lower than what we would actually like because of of worry that what would be the consequence of it. But then once we checked it up after the angiography, we found that there was still appeared to be a significant amount of residual narrowing, and we knew that either we had to go ahead and take that risk and put the stent higher up, or else give her a high chance of the whole thing collapsing and not getting any benefit of the procedure. So we had a detailed discussion with her and her husband, told her what are the probabilities of things going wrong following the procedure in terms of either cranial nerve palsies or pain. They actually were supportive and told us that agreed to go ahead with the procedure. So we brought her in next day morning, and we placed a stent higher up. So this is what it was the next day morning's first angiography. You find the stent is there over here, above that narrowing persisting. Then we went ahead, put in another stent, and during the procedure she did have some amount of pain, but the moment the balloon was deflated, her pain subsided, and this is the result that we have got after the stenting. I think this is an excellent result. She is quite stable, and we are happy that we could pull this off without any major complications. Of course, we need to watch for another couple of hours to see whether there would be any chances of the cranial nerves being involved. Being a small stent, my feeling is most likely we should be able to get away with it. Multiple sclerosis. You wanted to discuss the other ones? Because it's as immediately after the procedure, it's a very tolerable discomfort. We expect that in 48 hours.
Okay, medicine.
You would need to be on blood thinners for a longer time because they use smaller stents on you.
Okay, what kind of blood thinners?
You would be on aspirin and clopidogrel or Plavix that he had as well.
Plavix?
Yeah, for the first 6 months.
Because
And then also on acetrom or Coumadin for 1 year. For a
my
year.
daughter should be sufficient. Is that something that I will purchase here?
Plavix, if you would want to, yeah, you could.
Or should I?
How soon should she be on them? Right away?
She's on it right away.
Okay.
We loaded her from the day she arrived in India.
Oh, you did?
Yeah, because we need to load more the patients
Oh, that's all the
preemptively
pill?
for the... Yeah, that's the pill you got.
Okay, the pills that I took last night?
Exactly.
Okay. And I'll get some more?
You'll get some.
You fixed me up.
That's good. All right, thanks.
Okay, thank you.